You can see cough, congestion, runny nose, fever, headache, upset stomach. Almost anything can be a symptom of COVID-19 in a child. What you don't tend to see as much early on in the disease in children is the respiratory distress. That's not to say it can't happen, and unfortunately, in some cases, it does. And we do have children that end up in the hospital with respiratory distress from COVID-19. We do have children who end up in the intensive care unit. We do have children who end up on ventilators, and we have several in South Carolina right now. So it can be a very severe disease. The symptoms can look very similar to what you see in adults. Babies with COVID-19, obviously, it's trickier. They can't tell you what they're feeling. So it may just be the baby that's fussier than usual. It may be the baby with a fever and you can't tell why. Again, almost any sign of illness can be a symptom of COVID-19. It is so much more contagious and easily spread than the initial strain of coronavirus. So what that means is that we are seeing far, far, far more children being exposed to coronavirus, especially now that our schools are open, and especially now that in South Carolina, our schools are open without mask mandates. It's much, much more transmissible. Whether the Delta variant is actually making the kids sicker is still a little bit up in the air, because you have so many more sick children. So you would think, yes, you're going to have more very sick children as well. Whether that is out of proportion because of the Delta variant is a little bit hard to tell right now. My gut instinct is that it is causing more severe illness as well. But unfortunately, we're only going to be able to really say that in retrospect when we're able to look back and see what proportion of the kids with coronavirus are actually getting very sick and ending up in the hospital. I really don't think that there is any data to indicate that that is happening yet. We certainly do know pregnant women do appear to be more vulnerable to severe illness, and pregnant women who are unvaccinated appear to be particularly vulnerable to severe illness. I have seen a couple of new babies now that got it from their mom right at the time of delivery or just before the time of delivery. Those babies that I have seen and similar babies that my partners have seen have done well thus far. So we have not seen anything yet that would make me think that new infants are more vulnerable than older kids. It actually seems, if anything, that the kids we're seeing end up in the intensive care unit largely tend to be the older kids. We basically created the perfect storm this year, unfortunately. Last year, we used all of the precautions we had at our disposal. We initially started our schools virtually, and when it was safe to do so, the kids went back into school, but in a hybrid fashion. So you had smaller groups of kids in the school. They were wearing masks almost uniformly because they were able to distance. You didn't have the kids right on top of one another, and you didn't have the Delta variant. And then as you got later into the school year, you started having folks getting vaccinated. This year, all of those mitigation strategies and all of those layered protections are gone. So you have classrooms that are chock full of kids. You have a ban on mask mandates. So you have some kids wearing masks, and you've got some parents sending their kids off to school saying, please keep that mask on. But you don't have everyone wearing masks. You don't have everyone vaccinated, and certainly kids under 12 can't be vaccinated. In a lot of places, you have old schools with poor ventilation, and you have a variant of the virus that is much more contagious. So literally, the layers of protection that we need to put in place are not there. I believe that all of the intensive care units in all of our children's hospitals, and we have 4 in South Carolina, I believe that there are kids with COVID in all of our intensive care units right now, but there absolutely are kids with all kinds of other things in our intensive care units right now as well. We're also seeing a surge of RSV, respiratory syncytial virus, right now, which is a little bit odd because that is usually a winter virus, but it is definitely surging right now. And we have some children in our intensive care units with that. And then just the things that normally put kids in the intensive care unit. Sometimes kids that are post-op from certain surgeries have to go to the intensive care unit. unfortunately, injuries, gun violence, things like that, puts kids in the intensive care unit. There are all sorts of things. But the problem is, as we fill up our intensive care units, and you have a bunch of kids with COVID in each of our intensive care units, you run out of space. Our intensive care unit in our children's hospital here in Columbia has been full for weeks now. And on many days, we've been holding kids in our emergency room, waiting for an intensive care unit bed. We don't turn anyone away. Our children's intensive care unit at Prisma does not turn any of our local kids away. If they need that level of care, they're going to get that level of care. But initially, they may not be able to get that level of care in the ICU. They may be in the emergency room waiting for that bed for a good while. So in that case, it doesn't much matter if the issue was COVID or not. If you need the bed, you need the bed, and you need that level of care. And that's one thing that's really important for folks to think about. If they're stuck on that issue of, well, COVID doesn't matter, or COVID isn't real, or COVID doesn't make kids sick. It doesn't matter. If you need that bed, or your loved one needs that bed, and all the beds are full, it doesn't matter whether you believe in those things or not. The beds are still full.